Hi all, thanks so much for watching Making Healthcare Work for You, Different Perspectives and Empowering Solutions. I'm Stephanie Fields, joined by my co-host Dr. Apoorv Gupta, and today we are welcomed by Donna Sabol, who is a Senior Vice President and Chief Quality Officer at St. Luke's University Health Network. Thanks so much for being here.
Happy to be here.
We had a fabulous pre-interview with you talking about all of the ways that St. Luke's really embedded love through everything from values to teamwork to genuine love, really, from start to finish for your staff, for your patients, through tough conversations. And it's led to incredible outcomes. You said that you said high quality equals low cost or something like that. You said, and I thought, wow, that's something that we don't hear very often. And how important you keep coming back to love and care and the interest in being together. So what is it that makes St. Luke's so special?
So St. Luke's culture is all about relationships. And I would say what makes us so special is our leadership team and our CEO. Rick Anderson is the longest tenured CEO in the country. He's been here 39 years. And when Rick started way back then, he repeatedly would say to folks, it's not about the bricks and mortar, it's about the people. And so through his leadership and the leadership of our board, culture and relationship has been a priority for the last over 35 years. And we've built on that culture over time. People genuinely like each other at St. Luke's. We like working together. We actually have fun working together. And I think, in this organization, when I interview people that are coming in, I let them know St. Luke's is all about relationships and healthy, positive relationships. So what do I mean by that? I think if you're going to truly be a loving organization, you have to help people succeed. And we help people succeed by mentoring. So right now I'm mentoring about 5 people. Some of them are physicians, some of them are first line supervisors, some of them are more seasoned administrators. And people mentor me when I need mentoring. It's a journey. It's not something that, we're all evolving over time, and we recognize that. So one way that we help people succeed, and I think this is really important in a loving organization, is that we give people the skills to manage conflict and to have crucial conversations. I think there's nothing more unloving than letting someone who isn't doing well continue to not do well. We're as strong as our weakest link, right? So if we can help people we bring in succeed and be strong, then the organization performs well overall and people feel safe. Again, I think, if you're truly a loving organization, you want people to feel safe. And I'll use an example that, our CEO says all the time. He talks about the fact that in healthcare, you have to be innovative and you have to reinvent yourself. And so when you're reinventing yourself, you're going to take risks. And his message is you need to take risks. And when you take risks, sometimes you're going to win and sometimes you're going to fail. And it's okay to fail. But what you do when you fail is you own it. You figure out how to do it better. You can't make the same mistake all the time. So it really creates in St. Luke's a sense of let's try that. Or I can do something that maybe isn't fully tested yet and see how that goes. We've incorporated that approach too, I think, which is really important since we're a major teaching hospital, into our medical students' curriculum and our residents. And as a chief quality officer, one of the things I'm really happy and proud about is we have a network quality awards program that I established. It's about 18 years ago now. Last year, we had 60 submissions of projects, and 20 of them were resident-driven. So we've really incorporated into our GMA programs our quality program. They're an active part. And we have something called the collaborative newsletter, which is all of the work GME and quality are doing together. And the latest edition just came out. That newsletter goes right up to our board. And so when I call the winning teams for our quality awards program every year, it is the residents who get the most excited. And it is so cool to be able to teach residents how to do performance improvement and achieve high quality. So I think, just investing in people is important. We're also doing a lot of succession planning, because we recognize that we do have a senior team here. We have people who have started retiring that have been in senior positions for a long time. And so it's important for us to develop the next generation of leaders. And that next generation of leaders, they want to continue the culture. They recognize that the culture is the key to our success. So we've done a lot of work in terms of succession planning and continuing to identify folks who have a career path that we want to invest in. We also work with our physicians in a dyad model. So that's really important for physicians to have an administrative partner. And I always say the physicians bring their clinical expertise, the administrative partners are bringing their operations and business acumen. And when you put people together and they genuinely like each other and work well together and have a common purpose, really beautiful things happen. We really like being together. And when I go to a chair meeting, chairs come up and we hug each other. Our board starts their meetings early so that they can interact with the administration and spend some social time together. Our board members are all from our communities. They're really invested in our organization as a whole and really freely give of their time and knowledge to help us. So we like each other and we have fun. I come to work every day, and people will ask me, when are you going to retire? Well, I'm not ready to retire. I come to work every day because I really love the people I work with. We solve tremendous issues, and high quality is low cost care. And so we're proud of what we've achieved in terms of external recognitions with, whether it's the 100 top hospital, the 50 top cardiovascular. We've been a 15 top health system winner. We're straight A leapfrogs. We've got leapfrog top hospitals. The list goes on and on. I can tell you that we're going to be all 5-star but one hospital for CMS star ratings in July. We got our preliminary data. So, just being really proud of that. And I use a quote from Michael Jordan, which says, talent and intelligence wins games, but teamwork wins championships. And so what you would see if you came to St. Luke's is you would see people really working well together, enjoying each other's company and problem solving very difficult things, but with a lot of focus and genuine support for each other. So it's just, I feel blessed and privileged to work in this organization and to work with the people that I work with. And when I retire, I probably won't fully retire. We jokingly say no one ever fully retires from St. Luke's. Our CNO tried to retire. She also was our hospital president in December. She's working part-time on a project. We have another senior leader who's going to be leaving, but not fully. He's going to work on a project. A lot of our staff come back. So if you went into our ambulatory surgery centers, a lot of the nurses are nurses that retired but couldn't stay away and came back part-time. I also will tell you the level of caring and love for patients. I had surgery a couple years ago, and my anesthesiologist went and got a warm blanket from the warmer and tucked me in before he took me back to the OR. And I get choked up when I say that. Ooh. But that's for every patient. So, I don't know that anesthesiologists in all hospitals are tucking their patients in with warm blankets before they take them back to the OR. But again, I think that's the level of caring that exists here.
It's incredible to take in. I've actually been smiling just throughout the whole session, Donna, because
I
it's
always get choked up when I tell the anesthesia story after all these years.
amazing. Yeah, it's amazing. It's just, I mean, again, it's a really nice way to illustrate how love actually works, and that's there, and it's there in these small ways. And I'm just like, I can't imagine you've been there. You've had such longevity yourself. You've been at St. Luke's for 42 years. You told me, I think 17 years as chief quality officer. Incredible longevity. I mean, the shepherding that you and your CEO have been able to do over this incredible culture over such a long period of time, is clearly evident. And the way you've integrated into all the different elements you were talking about, the culture, the education, the mentoring, all the training that you do is incredible to hear about. You've actually given us the playbook, I think, for developing a loving organization. So we really need to all be taking notes and thinking about how we develop this. The questions that come to me, Donna, as you're talking, clearly it's a work of love itself, and a labor of love, as they say, over many years to create this culture. One thought that I keep having is, you talked about mentoring, you talked about conflict resolution, you talked about education, and a lot of people try to do that, but they're not able to systematize it per se. In that, how do you ensure that gets out to every single person in St. Luke's? So what are the tricks that you did to do that, to scale it, to really make sure that all the people of St. Luke's are living and breathing this way and feeling that this is the way that St. Luke's operates?
A couple things. One thing we've done over the years and continue to do as people come into the organization is MBTI. So people know their personality type and how they interact with each other based on whether I'm an extrovert, an introvert. Those kind of things really help people understand why some people don't speak up right away, or some people are always coming up with the solutions, and or some people focus more on task versus the person impact initially. So we've done that, and we continue to do that. We've used the book, Crucial Conversations, and I have to hold it up because we're actually doing a book club right now with all of our quality staff in the network. Now, I've done this book club several times in my tenure here, but we've got a lot of new people. So we're actually meeting every other week for a 2-hour period. We've assigned chapters, and we're having the conversations about how to do this, why it's important. So we do that with our management team as well. We do an offsite leadership development program every year for over 1,500 leaders in our organization, and bring in outside speakers. I think the next one we do in September, we're going to revisit the generational differences. It's been about 10 years since we did that. And as you know, that's probably a common theme across hospitals, is how do we deal with these younger generations? Well, you can be critical of younger generations, or you can learn and understand them and learn how to interact with them. So that is something that is a priority for us for this fall for leadership. We actually have physician chairs doing leadership development with their physicians. So our chair of orthopedics, for example, has a whole curriculum on leadership relationship development principles, and they actually used Crucial Conversations as a book club book with the orthopedic surgeons. And I kept saying, I want to be a fly on the wall for those meetings. And then again, our evaluation process. So we have certain values. We have awards every year where we recognize staff who exhibit those values. Our values are called PCraft. It's pride in our craft. And so each of the values, people can submit coworkers who display those values strongly. And that's throughout the entire network that is done. And there's a lot of marketing and publicity given to that program every year. And then you can do a Bravo. So you can put into our system a Bravo for someone who did something great, and it can be something very small. That recognition goes right back to that staff member. And I will tell you, folks love, like, if I recognize someone who's done something great, they will invariably email me or call me and say thank you. So there's an appreciation among people when someone recognizes, and we do a really good job of managing up. So we address the critical things that need to be in terms of differences of opinions, and when someone's not performing where they need to. But we also manage up and let people know when they do something really well. And that's, again, pervasive, high-fiving each other. people feel really good about the fact that they're recognized at all levels. And so we continue that. We're finishing an employee engagement survey. Last year, our survey results were phenomenal. We know they're going to be phenomenal. We even did an employee engagement survey after the first year of COVID. And our results were really good because we took care of our employees during COVID. And so I think we don't shy away from the tough stuff.
I think that's really important. And it's interesting. I thought back to our interview with Dr. Helen Reese of Empathetics, and she said that one of the crucial things about putting empathy into an organization is just having leadership acknowledge to the staff that self-empathy matters and showing that you do care about them, which is clearly something that St. Luke's is doing really well. And you said in our pre-interview so many times, investing in them from various ways and making sure that they're a cultural fit, because that is your secret sauce. So how do you do that? Is it from these programs that you have, or by leading by example and showing? Because you said the succession planning is very important, that you want to make sure these people are in place who understand that. And then also by having core values that matter and being able to say, okay, this person doesn't fit, so maybe it's not the best home for you, having that conversation in a way that's going to be mutually beneficial. Sometimes it's not going to work. And
Yeah.
I think also the risk element is interesting in that too, because you said that making it a safe space for people to take those risks is a form of investing in them and showing that their opinions and the things they want to try or they think work. You hire smart people, you want to hear about that. So how does all of that connect to just the investment in the people feeding into the culture and the innovation that you're able to experience subsequently?
A couple things. One, we have a very strong organizational development department within our human resources, and we all have a human resource business partner that is assigned to us. And so when we do have those situations with employees that may be, or managers that aren't a fit, we have that area of expertise to help guide us through that. And so that is really, I think, something that our leadership team values tremendously, because it's never easy to have to counsel someone on performance. It should never be easy to have to counsel someone out of a job. And we say here, if that ever gets easy, maybe it's time to look at yourself in a leadership position, right? Because those are very sensitive and difficult things to have happen. So there is a great degree of sensitivity surrounding and support and expertise to help us when we have to do that work. So we do it well. People maybe sometimes too many chances, but we work through a process to help people develop and grow, and sometimes people just can't, and you do have to part ways, and that's just a reality of having over 20,000 employees in an organization. But again, never easy. So I think again we're blessed to have that support from our HR colleagues, and that really is a common kind of glue that keeps everything, making sure everything's happening. Also, when we're hiring folks into leadership positions, we put them through some tests, a CPI test. We look at where their strengths and opportunities for development are. So right from the get-go, it's very transparent that you're going to have things that you're going to do well and things that we need to help you grow and develop in. There are no surprises. There should be no surprises. And I think being transparent and doing a good evaluation up front is the key to success for that.
With every answer, Donna, you've given just another depth and breadth of everything you've done. It's really honestly breathtaking to think about all the different ways in which you've truly integrated this whole culture of love and relationships and people all throughout. I mean, I have to pinch myself because we're on the search for loving organizations, and it's rare that we find one that's integrated the love so deeply into everything that it's doing, into the strategic
I
goal.
would I would invite you to come on site. When you come to a meeting here, you're going to have as much fun as we have with each other, because it's just our approach. And when the premier folks come, we're all hugging each other before a meeting. So we extend that relationship orientation beyond our own employees and staff. When we partner with an organization, we look for that kind of relationship. And we've been able to have people want to come to St. Luke's to do innovation, different companies, because they like the feel and the fit of the culture. So it's paid off in many ways for us to be a genuinely warm, loving organization.
Amazing. You're like a hub of loving innovation is what I'm thinking of. It's amazing how that's spreading, and hopefully that will continue.
Thank you all for watching. We'll talk to you soon. Bye-bye.